Good morning, everyone, and welcome to Great Day Houston. The video we just showed you had over 1 million views, mostly because it's hard to believe that much stuff came out of one person's nose or nasal cavity. How that person could breathe, I have no idea. It can be part of the reason you have recurring infections, sinus headaches, lack of taste, and stuffiness. Joining us with how to fix fungal sinusitis is Dr. Raza Pasha, ENT and surgeon with the Pasha Snoring and Sinus Center. He is the surgeon in the video that we just showed you. Good morning.
Good morning.
Okay, that is crazy. I know why 1 million people looked at that and continue to look at that. In general, living in Houston, allergies and sinus issues are a problem. But what was interesting about that is that you always say our nose is right here. You as a surgeon know that the nose is much more than that, and there's much more in there causing problems.
That's right. When we think about the nose, we think about the external nose, and the external nose, all that does is just prevent water from going in your nose. The action is back and behind your nose. We've got sinuses that are involved, so there's a lot of volume, a lot more than you think.
Yeah, all right, so allergies, asthma, you treat all of that stuff, but when we talk about fungal sinusitis, that's a little bit different beast.
It is, and we've got two problems in Houston. We've got bad allergies and we've got mold and fungal issues. Those two combinations are synergistics, and we get something that's called fungal sinusitis, which is much, much different than regular sinusitis.
All right, so we already have fungus and bacteria and yeast and all that type of stuff that are in our body, but this is when things go awry?
That's right. So we naturally have fungus in our nose, we have it in our back of our throat, we have it in our ears. However, there are people out there that actually have an allergy to their own fungus in their face, if you can imagine that. So when you have an
allergy, that means the body is reacting.
That's right. So you have this hypersensitivity. It has to do with your immune system. And it's not necessarily an infection, but it's rather that the way that your body reacts to bugs and fungus that's already in your sinuses naturally.
Okay, so what was happening in that patient that you saw is that, and I think for a lot of people, they have some of the symptoms that we talked about. Let's run through those symptoms again.
Yeah, so congestion, facial pain, recurrent sinus issues, watery eye, sneezing, itchiness if you have allergies. Very common symptoms. The problem is if it becomes recurrent or persistent.
Yeah, but what becomes recurrent are the medications we use. You know, people run to the over-the-counter medications and they go, oh, look, this takes care of all those symptoms. It's not ever really addressing the major problem.
That's right. And if you're having recurrent issues and you find yourself taking medications and antibiotics year and year, month after month, there's an underlying issue that's there.
The other problem, Dr. Pasha, is that sometimes people will go and say, well, my doctor said it's just sinus problems, unless you're with a specialist who knows to go beyond, because sinuses can't be seen in a routine exam, right?
That's right. So in his case in particular, this gentleman had very little symptoms accurately. I mean, he had nasal congestion, he had facial pain. Yeah. But
any one of those is enough to bring you in.
Exactly,
yeah.
But we have to take a look at these things. And when someone has recurrent issues, we have to look inside the nose, we put a scope in there, we take x-rays, we allergy test, and we really get into the weeds on every patient so we can find out what's their underlying cause.
And patients are different. Sometimes it's not just that. Sometimes you can have asthma thrown in there. There can be polyps thrown in there, all kinds of things. We always joke that you're a detective as well as a doctor.
That's right, and it's never the same.
Yeah.
It's never the same. Every patient has their unique, every patient is utterly unique. And the success is to cater a program specific for that person.
Yeah, all right. So what was the program for this person? And how prevalent is that?
Well, okay, so fungal sinusitis is more prevalent than people think. It's probably about 10% of my population.
Yeah, especially in Houston.
In Houston, yeah, because we have bad allergies and then we have this fungal issues and it seeds in our sinuses quite easily. And then what happens in this case is, again, it's a very simple problem where you have to get that fungus out.
Yeah.
You do, and if you saw, I mean, you would think by how much, stuff came out of his nose.
How was that man breathing? How was he breathing?
Exactly. You would think that where's the room for all that?
Yeah.
But again, your nose extends out. And by the way, that's from one side. That's not from both sides. That's from one side of the nose.
Well, a lot of people who have those issues are mouth breathers, right? Because we just kind of compensate. And so if you're breathing through your mouth and it's hard for you to breathe, like I actually, after last time I saw you, I was like, let me test my side. Okay. Just to test, because there are people who go around breathing through one nostril and don't realize it.
That's right. And and again, that particular person, when I was taking that video, I didn't realize how much stuff was coming out. It just kept coming out, kept coming out.
Yeah.
So the point of it is that you just have to kind of spend the time and look at and find out the details of what's going on, and then you know, this is like a 90 difference. Yeah.
Wow. Okay.
Obviously.
You're double board certified and FDA. You've done a lot of FDA trials. You've actually pioneered a number of procedures, balloon sinuplasties, all that type of stuff. You treat sleep apnea, snoring. You have custom dental devices. Anything that's happening with you from here, right? He can take care of. But Dr. Pasha, thank you very much for making us aware of that other thing. Because again, I think so many of us try to take care of. We're busy. We want to take care of stuff ourselves, and we just throw medicine at it, and it's not getting to the root problem.
Thank you.
All right.
Appreciate you.
If you have trouble with anything concerning your sleep, snoring, or allergies, book your appointment at the Pasha Snoring and Sinus Center. The number to call is 713-523-8800. That's 713-523-8800, or log on to pashamd.com. I'm sure a lot of people are testing their nostrils right now.